Hello, this is Dr. Bob Browner from Partnership for Healthy Linking. We're going to talk about putting the obesity epidemic in context. Some slides you're going to see here basically come from the CDC. This is 1990, when people first started thinking about following the obesity epidemic. You'll see that some of the states' obesity rates are 10 to 14%, some less than 10%. As they followed this over time, every couple of years we had to add new categories as the obesity epidemic progressed. Here we are in 93, up to above 15%, 98, above 20%, 2002, above 25%, 2005, above 30%. And here we are in 2009, now with 30 states, more than 30% of the adults being obese. Here's a comparison from 1990 to 2009 where you can see them next to each other. Where we used to start, the heaviest state had 10 to 14% obese. Now the skinniest state is 15 to 19% obese. Comparing us to the rest of the world, you'll see that we're far above most other countries. OECD countries are what we might think of as first world countries. We have more than twice as many obese people as the other countries, which has a lot to do with our healthcare costs. The cause of this is expanding rates of diabetics. We're doubling our number of people with diabetes about every 5 to 10 years, and this is projected to keep increasing for another 2 to 3 decades to where we're expected to have 3 times as many diabetics in about 15 more years. And then the result of all these increasing diabetics is our medical costs. Here in Lincoln, Nebraska, projected in 2008 that we spent about $400 per person for the direct medical costs of obesity. That's money coming from each and every one of us in our health premiums and our taxes. That's expected to increase to $1,500 per person by 2018. For the city of Lincoln, that's about $377 million a year. If you expand that to the state of Nebraska, that increases up to $2.7 billion a year. And I think that leads to the question what better things could be done with that money if we could limit the increasing rates of obesity here in Lincoln and in the state of Nebraska. Unfortunate thing, of course, is this is present in our children as well. You'll see here in the 70s, about 5% of our kids were obese. Now we're around 17 to 18% of our kids being obese. What you see here, too, these rates of obesity, when they're reflected as adults, this will be far higher in the next 10 to 20 years because those obesity rates in 2009, which we think are so high, are based on children who were born in the 70s. Now that we have kids that are 3 times as obese, what will our obesity rates be in another decade or two?